Hi, I'm Frank Diamond, the managing editor of Infection Control Today, where we're helping infection preventionists and others on the front lines get a handle on the COVID-19 that's besieging America and the world. Once we defeated COVID-19, once we're able to return to normal, so to speak, there will be a lot of second guessing about what we're going through. Bet on that. With me now is Professor F. Randy Vogenberg, a principal of the Institute for Integrated Healthcare. Professor Vogenberg has an extensive background in healthcare and currently serves as chairman of the Employer-Provider Interface Council of the Hospital Quality Foundation. Randy works with employers, in other words, gives them advice about how to better provide healthcare to their employees. Important customers include self-insured employers. Okay, Randy, COVID-19 has raised public awareness of infection preventionists and the job that they do. Do you see their influence expanding beyond the healthcare sector after COVID-19 has left us, which hopefully will be sooner rather than later?
Yeah, right, Frank. I think there's a real opportunity here for people that are practicing in infection prevention, infection control in the hospital to do more out of the hospital because it's such a public health issue and it's an important aspect for employer-based healthcare. So I could see different ways in which they could be working in this new landscape that we'll be in.
How new a landscape are you foreseeing? I mean, you keep in contact with employers all the time. What are they saying to you?
So they're familiar with occupational health, they're familiar with general health care, but the COVID virus information that has been ubiquitous has really raised awareness to a whole new level around what you can or can't do regarding this virus. So infection prevention really has become a major aspect of what can we do. We don't have drugs to manage symptoms and we don't have a vaccine. And we've never really been in this position. So it's kind of a unique situation and it's not a quick moving pandemic. This is a very slow and long lasting pandemic. So this is going to stay in the top of mind of employers for quite a while.
Do you see them actually hiring infection preventionists? Now, I know employers in recent years have been branching out and actually becoming, in a sense, their own insurance companies, the self-insured employers, and also branching into being their own providers in some ways, the ones that, for instance, the obvious case being having clinics on site. I guess these are large employers, of course, but do you see them forming a stronger alliance with infection preventionists and the infection prevention profession?
Yeah, I think coming out of this current virus pandemic, the crisis part of it, we have to find a way back to normal or the new normal. And how do we get people back to work, which we call return to work, and then keep them in a safe work environment. So yeah, I see a real opportunity for an expanded role by those that are working in hospitals or medical groups right now to expand what they're doing, either providing advice or consultation or maybe even direct services with an employer, which could be at the on-site clinics, as you mentioned, but it also can be other types of outreach and what we've seen already with telehealth.
How closely are hospitals and local governments, state governments, federal governments, and hospital systems and providers working? Have they drilled for this kind of thing? I guess I'm asking, or are they also improvising how they cooperate as they go?
Well, they drill on general issues and scenarios that have been developed over the years. But since we really haven't had a pandemic in decades, it's not one of the top of mind scenarios. There are some war games that have been referred to that the military has done, but we're kind of in a new area. So we are iterating as we go, we're innovating, and we see a lot of creativity and kind of removal of barriers very quickly. We're doing research now with FDA approval within a week or two, where it used to be maybe a year. So it's a whole new ballgame right now.
And where do you see infection preventionists fitting in with that in that scenario?
So I think they're part of a team. Just like they are within the hospital, they have some specific responsibilities and oversight in working with protocols or teaching and training. Same kind of needs exist with an employer as we come out of this crisis. What do people need to know? What do we need to do? What are the protocols? What are the procedures that we need to have? So there'll be definitely consultations needed. It's an outreach or a service that the hospitals or medical groups may be providing to the employers. Most employers are small businesses. So there's going to be a need, maybe through a Chamber of Commerce or other groups that organize larger numbers of employers to help them work through the return to work issues. Yeah, I think like with anything that's new, you figure out, so what is the new path forward? And what are the relationships that you have with the existing infrastructures and committees and teams? And what role can you be playing on them? We saw the same thing happen. You mentioned the antimicrobial stewardship is a good example of how it changed what nurses do in some cases, as well as what pharmacists do in quite a different direction and responsibility within an organization. So in a similar way, I think this, how do you maintain a self-work environment, is going to be expanded to include what are we doing around virus prevention going forward, which is something that never has been in front of mind at most employer workplaces.
And how do you think employers are going to respond to that? Well, let me ask you this. Do you think large employers are going to be more responsive to this than smaller employers? I guess I'm assuming they would be because they have more resources.
Well, I think it's partly the larger employers because of the numbers they have to deal with, but it's also all employers because they all have the same problem of how do I accept a employee back into the workforce after they've been symptom-free and so forth, as well as how do I maintain them in the workforce on a daily basis as they're working with their colleagues. So some of the different industries I think are going to be impacted more than others because of the way in which they work. So an automobile factory and retail and things like that as industries, this is going to be a much more important issue for them than a small little clothing boutique on Main Street, as an example. Restaurants, this will be an ongoing issue for them. Not only the chains, but also a lot of the smaller mom and pop restaurants because they're going to have a lot of interactions. So any high risk for exposures, which is the mainstay of infection prevention, that's an opportunity to be looking at going forward.
You see infection preventionists working with municipalities more, with state governments, local governments, I guess, especially local governments being perhaps the ambassadors from hospital systems to the towns or cities within which those hospital systems rest?
Sure. So just like they function within the hospitals today, there's some of the similar needs. We start looking at state and local governments. Some of them are fairly large. Some of the school systems, as an example, have a large number of employees and may already have their on-site clinic in addition to the school nurse, as an example. Mm-hmm. But cities right now, they're embracing not only if they have somebody in public health department within their organization or with the local hospital. So as an ambassador, as you say, from the local hospital, an infection prevention professional becomes an important contact on a regular basis during a crisis, but also long-term as they form these work teams or other kinds of committees to do the same kind of things that we're talking about with employers. They have to make sure that their employees are able to go back to work because they're an essential service at the city or state level. And they also need to be interacting with the public. That's part of what they are as a local or state government. So there are a lot of areas where there could be a contribution made either as an ambassador from their employer or as an independent consultant operator.
Are you getting a lot of phone calls from your employer clients? And I guess what I'm also asking is, have the nature of those phone calls changed? I'm imagining they have over the last 2 months. I mean, in terms of the questions they're asking.
Yeah, absolutely. So we gone from just the awareness about this virus and what it is and what does it mean to various stages of shutdown and home stays to, in some cases, a full quarantine. And so this is all new territory for employers for the most part. They've never had to shut their business down. So it's been a lot to work through in a very short period of time. Because we're talking weeks here, where we've gone from a fast-moving, high-profile financial economy to we have a zero economy going forward. I think we lost somewhere around 25% of our GDP within a month, something like that. So it's been a very dramatic change. So there's been lots of questions. But now the questions are just beginning to shift to, okay, it looks like there's light at the end of the tunnel. We're going to be able to get back to business. How do we get back to business? What does that look like? What do we have to do? What will be the protocol or the procedures that we need to follow to keep a safe workforce so that we don't end up coming right back around with this new normal? There's going to be a lot of different health professionals redefining who they are, what they do, to others that weren't formally aware of them. Even pharmacy has been kind of reintroduced in a way to the public. So I think it's a real opportunity for this area dealing with infection prevention to reestablish, reemerge in terms of what their role is, not only within a hospital healthcare system, but also what it is outside of those four walls and interfacing with employers and even with members of the public.
Professor F. Randy Vogenberg, thank you for joining us today.
You're welcome.